had the best job in Oregon. I wrote a column for the Oregonian newspaper, and there were two really good things about my job. I never had to go to the office, and I never had to talk to my boss. That's about as good as a job gets. What that meant was for 25 years I could go anywhere I wanted in Oregon. I could talk to whomever I wanted in Oregon. And 3 times a week I had to write 700 words and send them into the office. The really fun part about it was I didn't even have to pretend to be fair and balanced. It was all about my opinion. I could tell people whatever I thought they needed to hear. And then one night, a couple of years ago, I went home, sat down at dinner with my wife and told her I was going to leave the Oregonian because I had a dream. And my dream was that I wanted to work in health insurance. And she looked at me like I'd said, you know, I always wanted to sell used cars on 82nd Avenue. Trust me, honey, it's going to be really good. So why would a guy do that? Why would a guy walk away on a quarter century of the best job in the state? I did it because in that 25 years, I fell in love with Oregon, and I fell in love with Oregonians, and I fell in love with the kids of Oregon, and I got more and more worried about their future, because it seemed to me that there weren't going to be any jobs in Oregon. I'd witnessed in my time, you know, this enormous change in the timber industry, and we all waited for something to come along behind it, and sure, tourism was fine in that. But you could see this fundamental economic shift was going on, because it was going to get harder and harder for employers in Oregon to create jobs and to sustain jobs. And I wanted to get involved with somebody who wanted to do something about that. And we all know, I think, all of us in the room, and you've all been handpicked, personally invited to be here today, we all know what's wrong with the Oregon economy, that far too much of our economic base is being consumed by healthcare. And we all know, because we're all working on the front lines, what's broken in the system. And what's broken in the system is that far too many Oregonians are getting the wrong care from the wrong people at the wrong time, in the wrong place, and yes, at the wrong price. That's fundamentally why the system is broken. What attracted me about ODS Health, why I accepted the invitation to join them, was because they said to me, if you come with us, this is what we are going to do. We are going to change the way health insurance is practiced in Oregon. And we're going to make a promise to Oregonians. And in fact, to people all the way from Ashland to Anchorage, more than 1 million members, we're going to partner with them, and we're going to get them the right care, in the right place, at the right time, from the right people, and yes, at the right price. And if we can pull that off, if all of us together can pull that off, then the children of Oregon will have the future that they deserve.